Hi, my name is Aurelio Fernandez, and I'm the President and CEO of Memorial Healthcare System. It's been a while since I had communications with the community, but I think it's important for all of us to get an update on where we are with this pandemic. We have seen a 30% increase in the number of COVID admissions since March. This is something that is concerning, and it follows trends that every time there's a holiday, you see a pickup in the traffic through the emergency department and into our hospitals. As a matter of fact, we are, as a healthcare system, caring for more COVID patients than any other healthcare system in South Florida. It is a real credit to everyone in the organization and the way that we care for our patients. Through the end of April, we've done over 76,000 vaccinations for the community at large. Over 75% of residents over 65 years of age have been vaccinated in Broward County. We need to even go higher for the rest of the population. We have partnered with the Health Foundation of South Florida to create a message of awareness on the need to vaccination. Included in that partnership is Jackson Health System as well as Baptist Health System. We're encouraging every employee in the healthcare system to get vaccinated, and we will do whatever we can to help in that effort. Let's hear from our Chief Quality Officer, Dr. Tom Macaluso, on the importance of being vaccinated and following CDC guidelines.
The situation in South Florida with the COVID pandemic is not very good right now. We are at a point in Broward and Dade that's worse than it was in the spring. We thought a few weeks ago that the numbers were coming down, but unfortunately they bumped back up. So when we ask ourselves, how does this pandemic end? No one really knows that answer just now. However, there are several patterns that we could see. One is that we have a series of spikes or peaks that are short-lived but quite intense. That's what we saw in the summertime. What we're seeing now is something a little bit different. We're seeing a peak that was not quite as high, though problematic, but lasting for a longer period of time. And that can continue for some time until there's some other intervention that can break the pandemic. And so until we see a large number of people vaccinated, it's hard to see how we get out of this. For those of you who are hesitant about getting vaccinated, I think it's important to think about this. There are some vaccines, such as a shingles vaccine, where you're making that choice just for you. You're choosing to protect yourself or not. The COVID vaccine is different. It's like other immunizations in which not only are you making a choice for yourself, but you're really making a choice for other people. You're making a choice for a family member, a parent, a grandparent. Every patient that you see in the hospital got COVID from another person. They didn't just get it from anywhere. They got it from another person, and in all likelihood, they got it from an unvaccinated person. Choosing to get vaccinated is making a choice for yourself, but it's also for all of us. The risks of being unvaccinated to you and to your loved ones far outweighs any risk or danger associated with the vaccine. Please think about that and recognize that it's much safer for you to get vaccinated than to not be vaccinated, not only for you, but for your loved ones.
This is not over. Our job is to encourage everyone to get vaccinated. And if you have not, please consider it. We need everyone to encourage friends and family members to get vaccinated. We're all in this together. Let's do our part, and thank you for your support.